Good morning, and thank you all for joining us today for our forum titled Entrepreneurship and Access to Support. My name is Anya Pichenina, and I am a program officer here at the Kauffman Foundation, focusing on research translation work. Today's forum is inspired by the America's New Business Plan's fourth pillar called Access to Support. You can find a link to it in the chat window. This fourth pillar recognizes that when entrepreneurs strike out on their own, they often leave behind the salary and benefits an employer provides. Many entrepreneurs become responsible for healthcare, retirement savings, and other necessities they, their families, and their employees depend on. This can be especially challenging for entrepreneurs with little savings to draw on and for whom access to a safety net is particularly important. Today, we invited several panelists to share what they know about entrepreneurship and social safety net. One panelist is an entrepreneur who will speak to her lived experience with gaining access to support while building her business. A couple of panelists from advocacy organizations will share the recommendations that emerged from their constituents' lived experiences. And a few researchers who are working at the intersection of entrepreneurship and access to healthcare, unemployment insurance, and childcare. We have two exciting panels for you today. In our first panel, we will discuss the current US social safety net landscape and its impact on entrepreneurship, what works well and what is missing. We will explore what it is like to be an entrepreneur needing access to basic things like healthcare, childcare, or unemployment insurance generally, and in the context of the pandemic. In our second panel, we will discuss what are emerging and promising ways of supporting entrepreneurs moving forward. After each panel, we will have a moderated Q&A, and I encourage you to send in your questions to us in the Q&A box throughout the presentations. The link to the agenda for this event is posted in the chat window. Our speakers today come from diverse backgrounds in research, advocacy, and startup sector. I would like to thank each one of them for taking the time out of their very busy lives to share their insights with us. We host this forum to provide a platform for an in-depth discussion on how to solve problems, and Kauffman Foundation does not take a political or legislative position on these discussions. So with that, I would like to transition to our first panel, where we are going to discuss the current US social safety net landscape and what it means for entrepreneurship. We are very fortunate today to have four esteemed presenters for this panel. Indivar Dutta-Gupta, Co-Executive Director, Georgetown Center on Poverty and Inequity. Althea Erickson, Independent Worker Advocate, former Advocacy and Policy Lead at Etsy and Freelancers Union. Matthew Ray, Associate Director of Healthcare Marketplace Program, Kaiser Family Foundation. And Mrs. Heather Spalding, CEO of Cambrian. For the next 30 minutes or so, each of our panelists will give a short presentation, after which we are going to have Q&A session, where we will answer questions and address comments from the audience. You can find the link to the agenda for today's event in the chat window. Without further ado, please welcome our first panelist, Indivar Dutta-Gupta. Indi, please take it away.
Thank you, Anya. It's great to join everyone here. And I hope my volume's okay. I'm going to try to share a bit of an overview of some of the research related to economic security programs and how they can contribute to entrepreneurship. And before I do that, I just wanted to touch on what I think are four themes that come out of the literature. And the first is that reducing the downside risks of entrepreneurship by ensuring access to health coverage and protecting incomes does appear to promote entrepreneurship. And I do want to emphasize that it is in many ways about the risk. It's not entirely about people actually participating in these programs in some instances. The second theme, I think, is that entrepreneurship that stems from changes to economic security programs, as far as we can tell, doesn't seem to crowd out other entrepreneurship. Not all the research is able to sort of analyze that question, but overwhelmingly, this is what is shown from the research that does try to tease it out. The third is that, and again, simply not all research can demonstrate this, but by and large, the entrepreneurship that stems from economic security programs and their expansions is of at least as high quality as other entrepreneurship. And I think the fourth sort of final theme that comes out of some of the literature, and sometimes indirectly, but is that the entrepreneurs who may be likelier to begin as entrepreneurs because of these economic security programs seem to be more demographically diverse than other entrepreneurs. So those are the sort of four, I think, key takeaways in some ways, and I'll walk through just a little bit of the research. But again, it's that, you know, the downside risks being protected, especially with regard to health coverage and income, does seem to promote entrepreneurship. There's not much evidence of crowd out as a sort of second theme, and the third, that the quality of the entrepreneurship seems to be of comparable level or higher as other entrepreneurship. And finally, based to some extent on indirect evidence, but I think there's good reason to believe that the entrepreneurs are sort of more demographically diverse. So let's start with health insurance. I think this is where there's been much of the research. I think it's quite compelling. We've known for a long time that there were sort of interesting jumps in entrepreneurship related to eligibility for public health coverage programs. So, for example, turning 65 and qualifying for Medicare seems to make people likelier to start a business. Obviously, that's not experimental evidence, but useful descriptive information. That we know that workers who don't have a spouse with employer-based health coverage, especially in the past, were less likely to start a business. But then we've seen analyses, especially with the Affordable Care Act and the expansion, showing measurable increases by a few percentage points in self-employment, growth in business income, greater likelihood of being self-employed full-time, which I think is an important indicator. And likely this is driven by not just access to health coverage outside of the employer sponsored plans that are available to many working people, but also lowering costs seem to ease the sort of transition into self-employment for many. And there's also evidence that for some people, just access to health coverage for their kids makes a difference. So expansion of the state children's health insurance program, you know, appears to have significantly increased the chance of adults owning an incorporated business. And the share of household income also derived from sort of self-employment, which is often the proxy here used, it does suggest that these are relatively high quality ventures, as the actual sort of income share grew a lot for these households. So this obviously means, in contrast, that if people don't have access to health coverage or fear it, they might be less likely to strike out. We have another program that's much lesser known called self-employment assistance. It's much more robust in some other countries, especially France. It's part of the unemployment insurance program, but it's essentially a way for people who are involuntarily unemployed and have access to unemployment assistance to instead sort of take those funds and use them to start a business. And we do have some evidence that, and of course they'd be exempt from work search requirements, and instead would be focused on entrepreneurship and could get technical assistance. We do have some evidence that, you know, people who participate just do better, period, in the labor market. Even if they don't become entrepreneurs, they are likelier to find employment. Now, of course, there's some self-selection going on there, but you know, you are providing some access to capital here, and also maybe helping people just sort of focus on their interests and careers. There's evidence from France that their much more robust version of this program significantly increases entrepreneurship and does so on net without crowding out other startups, and that the at least survival rates of those businesses is comparable to those of other startups. And then just a couple of other quick points in the research that I'd lift up. There's evidence primarily from Canada that paid family leave is also quite consequential for business startups. One particular study of Canadian expansion of paid maternity and and overall parental leave, found that, and it was job protected leave. So you also have that backup. It's not just income while you're starting the business on leave, but also to return to a job if your business idea doesn't pan out. But that it led to a nearly 2 percentage point increase in entrepreneurship rates among mothers relative to fathers. And again, the descriptive sort of data suggests that the quality of those startups was likely to be at least as high, if not higher, over time than startups in general. There's similar evidence with Social Security benefits, just as we've seen with Medicare at age 65, that you see a sort of increase in entrepreneurship then. Now, I would also note there's similar evidence for the food stamp or SNAP program. And again, here you see that a lot of folks who seem to be likelier to start a business because of SNAP expansions, and in the states, it's a federal-state partnership, although mostly federally driven, they don't necessarily participate in the SNAP program during any period of their sort of starting up of their business. But nevertheless, you can see that that there's an increase. So it's the risk, again, that's being protected. Now, when you look at these programs, and also some evidence on sort of reducing asset limits and testing public benefit programs, also promoting entrepreneurship, by and large, the folks who participate in these programs do tend to have different demographics, more likely to be women, more likely to be people of colors, and particularly of various marginalized communities of color. And so that means that we're not just necessarily promoting entrepreneurship by mitigating some of these risks, but we're particularly promoting entrepreneurship among people who are least likely in many ways to start businesses otherwise, at least have the capital and funds to do it. I'll also just finally note, some people, of course, start businesses because of a lack of alternatives. A lot of people with criminal justice system criminal legal system interaction and records have a lot of challenges, also in accessing capital, but in accessing basic employment. And so you see a lot of entrepreneurship there as well. To some extent, many of those folks do have access to these public benefit programs. Some they don't in some instances. But whether it's sort of out of necessity or people sort of taking chances that they wouldn't have otherwise, I think there's a lot of reason to believe that while many of our economic security programs certainly could be better designed, even with just the goal of entrepreneurship in mind, that by and large, they probably do more to promote entrepreneurship than not. And this doesn't even get into potential local spending effects and things, especially when the economy is not at full capacity, when there's a case to be made that they increase local spending and likely stimulate the economy, especially again, when the economy is not at full capacity. So I'll actually just sort of end early there. I'm really excited about the discussion, but I hope that sort of overview of some of the key takeaways from the literature will be helpful as we go forward in today's forum.
Thank you, Indy. Althea, you're up next.
So my name is Althea Erickson. I have been working to update and expand the social safety net for entrepreneurs and independent workers for most of my career. I led advocacy and policy at the Freelancers Union, which is a membership organization that provides benefits and advocates for increased protections for independent workers, and then spent 10 years leading advocacy and policy at Etsy, the online marketplace for handmade goods. And in that role, I represented, now I think it's up to 7 million or more creative entrepreneurs who sell goods on Etsy. And almost all of them are women operating businesses of one out of their homes. And then actually starting next week, I'll be joining the Center for Cultural Innovation, helping them launch an advocacy and research shop dedicated to expanding social and economic protections for artists and those in the creative economy. So I've been working in this field for a long time, and I know that this forum is focused on entrepreneurship more broadly, but I really wanted to narrow in on one, I think often overlooked segment of the population, probably not to this audience, but to broader audiences, which is the self-employed, the non-employer businesses, the businesses of one, and the folks who want to remain businesses of one. This segment of the small business community is growing across the economy, and particularly among women and people of color. More people are becoming self-employed. I think today, 41 million people work independently in the US, and over the next 5 years, studies project that 53% of the US adult workforce will either be working or will have worked as an independent. And as I said, these trends are more stark among women and people of color. So in the 5 years before the pandemic, women-owned businesses grew 21%. While firms owned by women of color grew at double that rate, and firms owned by Black women grew at 50%. And those businesses are predominantly self-employed non-employers. So 82% of minority-owned businesses and 90% of all women-owned businesses are sole proprietorships. Unfortunately, I think despite the fact, sort of the broader attention to the changing nature of work and also this big growth in this community, the self-employed seem to remain largely an afterthought among policymakers and in some cases practitioners. In particular, I think that's true for the legitimately self-employed, those who are unaffected by the broader misclassification debates, but who don't fall into the typical categories of worker or small employer. I think policymakers, in my experience, often tend to put people in the boxes that they know, and the self-employed tend to operate in that gray area between worker and business owner. They're technically business owners, but their challenges, especially with regards to accessing the social safety net, are much more similar to those experienced by a worker. And as a result, I think their unique circumstances and experiences are rarely taken into account when designing social protections, workforce training, economic development initiatives, et cetera. In a lot of ways, I think of them as really an invisible economy. They're working independently out of their homes before we all were working independently out of our homes, lacking like a storefront or a union to call attention to them. And that sort of leads to them often being overlooked. And I think the experience of the pandemic really highlights both the opportunity and the challenge. So the pandemic hit freelancers and small businesses incredibly hard. As we know, business ownership declined 21% in early months of the pandemic. Minority and women-owned businesses, who, as I said, are predominantly businesses of one, suffered the most, with 41% of Black-owned businesses closing between February and April 2020. And those working in the arts were hit particularly hard. I think the good news is, in the face of those destructions, we did make big promising steps in COVID relief bills. So the initial COVID relief bills included the self-employed and independent contractors in their programs. The CARES Act included the self-employed and independent contractors in both the PUA program and the PPP program. While Families First did include some tax credits for the self-employed for paid leave, I think, unfortunately, many of those efforts broke down in implementation, which left many self-employed folks unable to access that much needed aid. So PPP, for example, was built around payroll, but the self-employed and non-employer businesses don't have payroll. And there were rules for self-employed folks, but they were very confusing, and they often disadvantaged self-employed folks relative to other businesses. So, for example, they weren't able to include the cost of their health insurance as their business costs. PUA was a whole nother challenge. States had to figure out how to stand up a whole new unemployment benefit on the fly, often building on infrastructure from, the 70s, 80s, 90s, I don't know. And I think the result was that, at least, when I was at Etsy, many of our folks weren't able to access either of those programs. And then the tax credits for the self-employed, while great, they couldn't collect them until they did their taxes the next year. And so as a business of one, when your personal finances and your business finances are often all mixed up together, that aid came much later than it was actually needed at the moment when they needed to take time off due to COVID. So that's sort of the bad news. I'd say the good news is that there are opportunities and we are making progress. In terms of the safety net, some that I've been thinking about a lot are the unemployment system. So at least a few states are exploring extending their PUA programs for independent contractors and the self-employed. I think those could be great models for unemployment protection more broadly for freelancers and independent workers. There's also some funding through COVID relief to modernize unemployment systems. And I think that could also be a really great opportunity. Around entrepreneurship training and support, there's the reauthorization of WIOA, the Workforce Investment and Opportunities Act. And also, I think we could think creatively about the American Rescue Plan funds that are coming through that to support entrepreneurship training and development. We talked a bit about paid leave. You know, there was a paid leave plan in the Build Back Better bill. We'll see what happens there. But it was great to see that the self-employed were included in that proposal. However, many of the details of implementation were left to the Social Security Administration. So again, we need to just develop a point of view about how to make sure that when we implement programs for this community, we're really building them in a way that works for the way that they are working. And then two other areas I think that are exciting, one around portable benefits. You're seeing some states like New Jersey experimenting, and also within the context of the battles in California around Prop 22 and AB 5, you know, you could see some opportunities to experiment. And I think there are some open questions about how do we make sure any new systems are interoperable and accept contributions from multiple sources, and could they sort of help think about how do we provide the infrastructure to expand those programs beyond the on-demand app economy? And then finally, there's some really exciting work, I think, happening around guaranteed income, a lot of exciting experimentation, including through mayors for a guaranteed income, some of the pilots funded by the Economic Security Project. There's a very exciting new Creatives Rebuild New York initiative. And I think we should be looking at what can these pilots teach us about their impact on self-employment, on entrepreneurship. How do they help? You know, are there additional barriers or opportunities we should be considering when we're designing benefits like that? And then I guess I'll just close out by saying, you know, it does feel like we're at a real moment of rebuilding. And, you know, we have a real opportunity to, as we think about how do we update the social safety net that I think the pandemic really showed gaping holes in it, to include and accommodate the self-employed and very small businesses. And I think the most important thing is to bring the experiences and unique circumstances of the self-employed and independent workers to the forefront of the public debate. You know, we need to bring their experiences back into the center. And when I was at Etsy, we often brought Etsy sellers to meet with policymakers, and there was nothing more helpful in breaking down those old boxes of employer and employee than meeting a person face to face and hearing directly from her about her lived experience. And so to me, that really is the path to making this invisible economy more visible, and to ensure that the 21st century safety net actually supports the 21st century economy. Thanks so much.
Thank you, Althea. Matt, you're next.
And I'm Matthew Ray. I work at the Kaiser Family Foundation. We're a nonpartisan research think tank, and we provide data and evidence on how the health system is working. And I work on a lot of our private insurance issues. So I wanted to talk to us about the Employer Health Benefit Survey and what's happening in employer coverage right now. So I think this is a good fit with what we just heard, and sort of the context of many of the challenges facing entrepreneurs and small businesses. So, if a slide can be both shocking and not at all surprising, it's this one. So employer health insurance is incredibly expensive, is the not surprising part. The shocking part is just how expensive it is. So in 2021, the average family health insurance plan was $22,000. So this is the cost to insure a family of four. And that cost is typically shared for those with employer coverage by both the worker and the family. So, sorry, with the worker and the employer. The employer chips in about 75% of the cost, and then workers chip in about $5,000. To cover just the self-only plans, it costs about almost $8,000 in 2021, and we've seen sort of a rapid growth in cost over time. So that's this slide. This looks at the change in family health insurance premiums over the last, almost 23 years, let's say. So since 1999, the cost of family health insurance has increased about 300%, which is this orange line that's sort of floating to outer space. Obviously, the growth in family health insurance premiums sort of vastly outpaces the growth in either workers' earnings, which is 90%, or overall inflation. So we saw relatively modest growth in health insurance costs this past year. It's largely driven by the fact we had much less healthcare use with sort of everything that we went through in the last 20 months or so. Healthcare providers have just done fewer so-called scheduled services, so-called elective services, as we had stay-at-home orders. So in the last, in 2021, health insurance premiums grew about 4%, still on pace with what inflation and workers' earnings grew that year, although we know that workers' earnings and inflation continue to grow. I think this is all just to set the context that the employer coverage, which sort of is how most of us get health insurance, and I think many entrepreneurs get them as a dependent on another policyholder, becomes increasingly expensive both for workers and for employers, and it becomes increasingly hard for small businesses to offer health benefits. That's kind of what I wanted to get at on this slide, is that we have the vast majority of businesses in the United States are small businesses. So we have about 1.5 million thereabouts businesses with 3 to 9 employees, and only about half of them, about 59% or so, offer health benefits to their workers, to any workers. Amongst these small businesses is where we find the most challenges. Overwhelmingly, employers tell us the reason they don't offer health benefits is cost, and then some share of those employers also believe that their workers have better options, or they have coverage from some other source, but cost is really what's driving this. Among those smallest employers who don't offer health benefits, a relatively small share try to do other things to offer health benefits to their workers, typically providing money for them to go purchase health insurance in the non-group market, buy an individual policy for themselves and family. But this is one of the places where we feel strain in the employer market's ability to provide coverage for people. Contrast this with large firms, which this is the top line is the percent of workers who are work at a firm where someone's offered health benefits, and it's 90 some odd percent. So almost everybody, or not, 9 in 10 people work at a firm that is offering coverage, and that's because most people work at large firms. Kind of my last kind of point on the employer market is that the coverage offered by small firms tends to be different than the coverage offered by large firms in lots of ways. And I think one of the most important ways is in terms of the generosity of those benefits. So the dark blue bars here are the small firms, and the light blue is large firms. And this is looking at the amount of the deductible that workers face when they want to use services. So typically workers or enrollees in a health plan have to pay a premium contribution to enroll in the plan. That's their monthly premium. But they also have to pay for healthcare services when they go to a doctor. And a deductible becomes one of the big ways in which that happens. So almost a quarter, over a quarter of covered workers at small firms are enrolled in a plan where they face a general annual deductible of $3,000 or more for self-only coverage. This $3,000 is much more than sort of the assets that people typically have or may have to meet that cost sharing. Raises questions about affordability for those who actually have to use healthcare among those enrolled at small firms. Large firms tend to be more generous in terms of, or have lower deductibles, may have on average, may have plans that cover a higher share of spending and may cover more services. So I want to flip from the employer market and just say something about individual coverage, which is the other way that very small businesses or various people who run very small businesses are covered by health insurance. And if you work at a firm that doesn't offer health coverage, this is your other option, is to buy a non-group policy. So just today, we know that for 2022, 14.5 million people purchased a health plan on the Affordable Care Act exchanges. And kind of the big issue, I think, this year that we're going to have to sort out is about these additional subsidies. So many people who purchase health insurance on the exchanges receive a subsidy. The American Rescue Plan, as was previously alluded to, did lots of things to put more money into the system. One of the ways it did that was to enhance subsidies for people purchasing this qualified health insurance plans. So looking at the 30 million people or so who are uninsured in the United States, well over 50% of them are currently eligible for subsidized coverage in some way, and they elect to not purchase that coverage or not enroll that coverage for a whole bunch of reasons, which I'm sure we can all talk about. These enhanced subsidies made another 1.4 million people eligible for subsidized coverage. And I think these additional subsidies is a big reason why we saw so many people enrolling in this non-group coverage this year. The problem is that all these additional subsidies are going to expire this year. So the big debate is going to be if we are able to find a way to enhance the affordability of non-group health insurance. And that was a major provision of the Build Back Better Act. And I have no idea what's going to happen, but I'm sure that may be one of the provisions they try to bring forward independently if they don't bring forward the whole package. So this slide kind of looks at the affordability of non-group coverage. This is looking at, for just an individual, what the average amount is that the enrollee is on the hook for to buy an ACA qualified plan with a subsidy. So the green is the enrollee cost. The dark blue is how much the ACA subsidy was, the subsidy just authorized in the Affordable Care Act, which many people at the time thought were not generous enough and still made health insurance relatively expensive. And then this sort of mid blue is the additional subsidy provided by the American Rescue Plan. So what this did is it reduced the cost of non-group coverage for people between 400 and 600% of the federal poverty line by $213 on average, reducing the enrollee cost to $340 and making the cost of plans for lower income households considerably less expensive, considerably more affordable. So this is something we're going to have to figure out going forward, and hopefully we can figure out a way to ensure continued affordability of non-group coverage. That's what I had.
Thank you, Matt. And our last presenter is Heather.
Well, hey, everybody. Thanks so much for your presentations. It's interesting. I was thinking I really need to get on here and talk about healthcare, and then everybody else covered it pretty thoroughly. So I'm the CEO of a company called Cambrian in Kansas City, Kansas. And I guess what my maybe different insight might be compared to what some other people talked about is my husband and I founded this company together, which changes things a little bit. We don't have a spouse to lean on in terms of getting healthcare coverage through Cerner or Sprint or one of these big companies here in Kansas City. So as the CEO, yeah, we started this company back in 2011. We had other full-time jobs. He was working at other small businesses, and I was at KU Med doing research and had our own healthcare that way. In 2016 was when we grew enough as a business that we needed to make the plunge. We needed to decide, is this a hobby or is this a career? And we were really passionate about making this business work and making it happen and spinning it up. And that's when we hired other employees. And that's when I started having to look into healthcare coverage for employees. I was shocked at what we found and the prices. It was very expensive to the point we couldn't offer it that first year. We were fortunate to be able to hire who we did. And then when Joel left his job, the company he was working for actually sold. He came to join Cambrian full-time as well. And after, COBRA ran out, we needed healthcare. We had 2 small children. So looking at the marketplace, yeah, we were able to get Humana coverage for us and our employee. And for our family coverage, it came to about $1,600 per month. And that was with the out-of-pocket max at $36,000. So it barely covered anything. And if we had some sort of catastrophe, like a car wreck or something, surgery, we would have to pay that year up to, over $50,000. And so it was shocking to me, just how little was covered and how expensive it all was. And there was a lot of debate about, would it be better to not have healthcare, and just save our money. We since then have now several basically full-time contractors, but we don't have additional employees. And fortunately, we were grandfathered into our plan because as of right now, me being, Joel and I being married, we really just count as one person enrolled, and we would not qualify for coverage now through Humana or any of these others. We're paying now about $2,000 per month for healthcare, which is more than our mortgage. It was more than our childcare costs. It doesn't cover everything. We still have to pay, I think, a 50% copay and deductible. So it's cost prohibitive to the point of being really scary, I would think. And I'm honest with people who are trying to start their own business, but it's much easier to have a spouse who has full-time healthcare. And we've gotten to the point, especially through COVID, where we had to offer our services for free to some clients because they were hit so hard. And we said, does one of us get another part-time job or not part-time, a full-time entry-level job just to have healthcare coverage? And I was on the CAE, the Center for American Entrepreneurship panel for women. And when I brought up healthcare, there's a lot of nods. And a lot of people saying that should they lose their healthcare, they would have to close their company. And that's exactly where we are. I tried the marketplace like so many other people, at least in Kansas, what we qualified for, being as small as we are, it was something like Bob's Health Insurance, and it covered a couple specific hospitals in the area, and it was still about $1,000 per month. And it didn't make sense. I think you guys really thoroughly covered healthcare. I just wanted to talk about my experience and what we're paying. It's one of those things where, should we have even an option for catastrophic health insurance? So put a, $50,000, whatever it is, put some sort of cap on there and make the monthly premiums real low, high deductible and low monthly. I think that would be so encouraging for so many people. There's a lot of young people that want to get started, but something like a hospitalization for COVID or a car accident or something unforeseen could ruin you financially. And I actually talked to somebody, I forgot to start my timer, so I apologize, but I actually talked to an entrepreneur who he was self-employed, sort of worked as a contractor. He found that his healthcare was, I think, $2,500 a month for his family. Okay, thank you. To the point where he thought it was no longer, he couldn't afford it anymore. He couldn't afford to pay that. And unfortunately, he got in a car accident and now owes, I think, $250,000 in healthcare bills, which that's everybody's fear. So you guys covered really thoroughly why this was so prohibitive. I don't know what the answer is, except for small businesses being able to, number one, qualify for good healthcare, things like Humana and Blue Cross, and then to have plans maybe specifically for small businesses. Maybe we don't give it as much coverage, maybe our deductible is higher, but it's affordable, or maybe we get some more benefits through monthly breaks or something. I'll go on just because it was so covered to say, for us, the safety net was always there in terms of could we get another job if this if God forbid, if our company goes under and we don't have any money, how quickly could we get hired somewhere else? Having an education where we both have a degree, that's a huge piece of why we feel like we could quickly get hired. Another thing is just how the market's doing. I remember being asked when Cerner was letting go of employees around here, would that have any impact on entrepreneurship in Kansas City? And I thought, well, absolutely. There's going to be that many more people, really skilled, educated people in the job market. And you have that in your mind of, if I can't close this deal or if I can't raise this round quickly, what is my safety net? What could I do? Where could I get hired, even for a little while? And so that is always in your mind. I would say too, for us, we have family in the area. And so I knew at the end of the day, the worst case scenario, we would still have shelter somewhere. We would still have some support. Somebody could watch my kids if I couldn't make the payment for childcare. And so having family or friends or some sort of support system socially for your kids, that they can be watched. We all experienced during COVID having kids home from school and needing to homeschool. And one of the things I was able to offer my employees was the flexibility in their time of having to be away at certain times because they're teaching their kids, or having kids get sick, or even this week school was canceled for one of my employees, and so he is staying home with his children because his wife is going to work. And you need a safety net of someone being able to watch your kids, something being open and available to you, having an education, being able to get a job should the worst happen. I think a lot of people, if they're very hireable, it's you feel so much safer going out and trying something new and starting something new. I know with this, especially already being in it, but being a married couple, that's probably the #1 challenge we have, because we're both entrepreneur minded. We both have probably half a dozen ideas each for companies we want to start. The big risk is neither one of us has that steady, safe, healthcare, childcare. We don't have retirement savings that is being built up for us every year. And we would love to offer that to employees. And that's one of the things that makes it hard to even find great employees, is we can't offer what these large companies offer. We can't compete with some of these large employer markets. And so we have to find anything else we can do to incentivize people to come join us. Because if you're really looking for that safety net, you can't, as a small business, offer it in the beginning. And that makes it really difficult to find good people and to have them stick with you. So we've lost people because they wanted to start a family and they needed affordable healthcare, or they needed, retirement plans and dental and all, and life insurance and things that we couldn't offer. It was prohibitive to us. So I'm really encouraged hearing you guys talk about healthcare and how that needs to improve for small businesses, because that's probably our #1 thing. So hopefully I covered a couple additional things. Thank you.
I would like to thank Heather for her presentation and everybody else's presentations today at this panel. We are now moving to our Q&A session. So I encourage everybody who is watching this panel to please drop your questions in the Q&A section. And my first question in the meanwhile is actually, I would like to get impressions from the first 3 panelists about Heather's lived experience and, maybe some thoughts on, how does it touch on your work and what you've seen?
Hi, I can jump in. I think, Heather, your experience is very similar to many others I've talked to. And I think we were all very hopeful with Obamacare that it would be able to sort of fix some of those problems. But unfortunately, I think it has solved for many people, but certainly not the experiences that you're talking about. And I, it really made, when we were at Freelancers Union, when I was at Freelancers Union, we were able to basically create a group of freelancers that were able to get large group rates for independent workers. And I think, I'm curious to see if that's a model that could be replicated again, or in the small group market to bring down the cost. I know there are challenges on the policy side, but they seem like ones worth trying to figure out how to overcome.
I love that you brought that up, because I have brought that up. I know KC Collective has tried that here, and then Pipeline, which I'm a member of as well, has tried that. And it seems so straightforward that we could, as a collective, say we've been employed, we've been self-employed for 1 year. Here's our documents to prove it. Here's our tax note, blah, 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 blah. Can we collect, as 500 of us in this area that need coverage, and pool and pay that way? And it has never happened. And what I was told by both places was, oh, you need more employees to get any coverage whatsoever. And I'm thinking, well, I guess I'm going to have to build this myself, because that's the entrepreneur mind. But it's awesome to hear that you've made this model already, because I think that's a model at the very least we could start with. And it's encouraging that people have already solved this, but it is a policy issue.
I mean, what I found compelling about Heather's testimony here was it spoke to two problems, right? The first problem is it's really hard for small businesses to offer affordable coverage. And second is that the decision whether you have health insurance or not really affects whether you can become an entrepreneur or not. And so that's like two different policy areas we need to solve. One is reducing the cost for employers to offer it, and the other is just making non-group insurance more affordable and available for people who are thinking about doing those.
If I could just touch on something else, Heather, that you brought up that I think is often not discussed, and that was childcare and childcare costs. And I think that's quite important. We see that now, where there are folks who use some of their monthly child tax credit payments to even help cover childcare costs, and they need that to be able to work. They want their kid to be somewhere safe, if nothing else, and ideally also somewhere that's enriching. And if they can't keep affording that, they'll have to, separate from employment. And we have lots of evidence that childcare assistance increases employment. I don't think there's been as much that's focused on entrepreneurship specifically, but I think that's really an important topic worthy of further discussion. Obviously, versions of Build Back Better had on just incredibly historic investments in childcare. I think there's also a challenge, Heather, I don't know what sort of hours you maintain, but there's also a challenge with alignment of childcare hours and when people work. That's a challenge for a lot of folks who are lower paid in jobs with unpredictable schedules, but also for entrepreneurs who may particularly need to work at non-sort of standard times. And so I think that's an area also worthy of sort of consideration, because it's a huge and growing cost. To some extent, the only reason why it hasn't grown like healthcare costs have is because we continue to pay the workers incredibly poorly themselves. And some of the workers themselves are entrepreneurs. There's a lot of home-based childcare, but that's an area I think that we should think about reducing the cost that families face, while maybe even improving the quality of the jobs that people do to provide childcare.
All excellent points. Thank you. So we have a few questions in the Q&A section. I will read one that I think is interesting in terms of college students from lower income backgrounds who are interested in pursuing entrepreneurship. And the question is, in your experience, are there things institutions or educators that can they do something to help them set them up for success in starting their businesses? What are the stakeholders and how can they help them?
I'll just say briefly on the sort of income support side, it's a tough particularly tough position to be in. I don't know if we're assuming they're dependent students or they're not, but it's difficult to navigate potential income supports and benefits. So I would, spend some time thinking about that. Either if the business effort doesn't work, or potentially even during a pursuit of the business effort, there are work-related sort of requirements for some programs like food assistance or SNAP. So that's just one thing I'll point out. Another thing, I think Heather pointed out some challenges of being married to your sort of co-founder, but I think having somebody else to do the business with and starting up with can make a big difference. Sometimes then you can sort of manage it while you're doing something else. A lot of people start businesses while they're already employed in some way or another, right? So I'll just stop there, but I think it's worth considering that as well.
The one thing I would add too is, really like entrepreneurship training in school is really important and something that is not often provided. And I'm thinking particularly of folks in the creative fields who have incredible skills as a graphic designer or photographer or what have you, or an artist, but don't necessarily have the business skills or have a full understanding of sort of what's entailed with running your own business or being an independent worker. And I'll even just give an example from my own experience. I was a freelance community organizer straight out of college and had no idea that self-employment tax was a thing that I was going to have to owe. And so, your tax goes up quite a bit when you're, particularly at community organizer pay. And I think that those sorts of like basics of being independently self-employed are things that a lot of college students don't know walking out into the workforce, and are things that our educational institutions could help fill some of those gaps.
I'll just jump in and say, I think like probably so many of the Etsy artists, and I've actually sold paintings too, so that I'm kindred. I'm an artist at heart. I didn't even consider myself an entrepreneur until very recently, even though I was running a business and employing people. And I think even having the mindset, especially probably as a creative person and an artist, of like, I am a business owner and I am running a business. There could almost be like just a packet. I know even getting started with an attorney to get the governing documents affordable real quick. This is how I onboard people. This is how I have a contractor. This is how I make sure I own what I need to own, and I'm not giving away rights that I don't want to give away. Is so helpful. But in personally, I've worked so closely with the SBTDC and UMKC here in Kansas City, and they have been a tremendous support, and they have an answer for almost every question I've come up with. And they connect you to other people, like-minded people wanting to start similar companies. And so having a resource like that in your city and then using it. I've even talked to other people saying, I've started this business, but I have so many questions about this or that. And I'm like, have you used this resource? No, I know it's there. Oh my gosh, just get started. Use the resources that are there. There's a community of entrepreneurs in every city that'll bend over backwards to help you. And then, yeah, just get started, even work for a small company. We had several people that came to work for us without education or background, but worked for us right out of college, and then went to start their own business after kind of seeing what it was like. And clearly I make it look easy. Just kidding. But yeah, there's resources that are great in cities like ours.
Excellent. Another question that comes to mind, and Indy, you had cited several research studies about various types of social supports and whether or not they help entrepreneurs. And I was wondering if there is a comparative perspective to that. Is the presence of a robust social service net actually increasing the success of entrepreneurial ventures? Is there evidence of that? And can anybody also expand on that as well?
Yeah, I mean, I'll say briefly, I mean, comparative in two senses. I think all the research is trying to have some plausible point of comparison. It's not a lot of randomized control studies or purely experimental studies. So there's definitely some statistical and econometric work that has to go into them by and large, but it's a consistent finding that the sorts of expansions that we have seen in real life in wealthy countries, including in the US, to health coverage and income protection programs do seem to increase entrepreneurship among affected people, and when folks have studied it overall as well. So there's a comparison for each study, and there's a comparison across countries. And there's a lot of factors that obviously affect entrepreneurship. This is one of them, I think, an under-attended to one, but obviously other things like access to investments and access to workers can affect them as well. But in general, you'd want to kind of compare rich countries because you actually see incredibly high rates of entrepreneurship in some of the poorest countries in the world, but that's because people can't grow businesses into larger businesses by and large. So, entrepreneurship rates in like Bangladesh are like 60%. And, in the US, we're looking at like 10% would be high. So among rich countries, though, the US doesn't stand out at all. So I think that's the other thing to keep in mind overall, that if we value entrepreneurship for whatever reason we do, we're surely not sort of maximizing that in the US.
We are actually coming up on the hour, and I would like to thank everybody participating in this panel this morning. I really appreciate the discussion. This is clearly not the end. There are so many things that we haven't even began touching on. So hopefully we'll have more of these discussions in the future. So thank you, everybody. And I'm passing this to the next panel. Jenny Kelly is the moderator. So please, Jenny, take it away.
Thank you all for joining our first panel. Like Anya said, I will be hosting our second panel of the day. Again, my name is Jenny Kelly Ventura. I serve as a program officer of policy at the Kauffman Foundation. Our second panel this morning is entitled Looking Ahead, Emerging Opportunities to Support Entrepreneurs. So as we heard in the last panel, there are a number of needs that fall into this much needed social safety net, including healthcare, childcare, retirement. So it's my pleasure to introduce you to our panelists this morning who are here to discuss some policy ideas that could offer potential opportunities and solutions to better support entrepreneurs. First, we'll be hearing from John Arensmeyer, who is the founder and CEO of Small Business Majority. Next, we will hear from Rakeen Mabud, who is the Chief Economist and Managing Director of Policy and Research at Groundwork Collaborative. And we may have a third panelist joining us a bit later. So when they do, I will be sure to introduce them. So with that, before I turn things over to John, just a reminder, we will have some time at the end for Q&A. So please use that Q&A box to ask any questions you may have. And with that, I'll turn things over to John.
Thank you, Jennifer, and thanks for hosting these panels. It's really important stuff here. Just a brief bit about Small Business Majority. We're a small business advocacy organization, national small business advocacy organization. We have our network, we have folks, 85,000 small businesses across the country in our network, and partnership relations with about 1,500 organizations that provide direct services and resources to small businesses. We ourselves really do two things. We provide information and resources to small businesses, and we engage in advocacy on a whole host of issues: access to capital, healthcare, paid leave, equitable competition. So with that, let me dive in here. Look, in the wake of COVID and the great resignation, so to speak, nearly 5.4 million applications have been filed to form new businesses in 2021. It's the most of any year on record. This is great, as entrepreneurship provides a pathway for women, people of color, veterans, and immigrants to enter the mainstream American economy and build income and independence. I also want to pick up on Althea's comments from the first panel that more and more Americans are self-employed, especially coming out of the pandemic. They comprise a critical component of our entrepreneurial landscape, particularly in under-resourced communities. But as she mentioned, way too often misunderstood and ignored by policymakers. But to support entrepreneurs, we must have a modernized and robust social safety net that promotes wealth creation, financial security, and quality jobs for those who don't work for large organizations, particularly those in under-resourced communities. As we see it, 4 benefits are essential to making this happen: affordable quality healthcare, paid family and medical leave, affordable and accessible childcare, and the ability to save for retirement. And the panelists on the first panel touched on all these in different ways. Let me start with healthcare. As you heard from Heather on the first panel, small businesses are continuing to struggle to offer quality health coverage. And while employer-sponsored health insurance is a vital component of delivering healthcare, only 40% of workers at firms under 50 employees are covered by ESI, and that number drops to 35% at those working at firms under 25 employees. So addressing the needs of the entire small business ecosystem requires that we look beyond traditional employer-sponsored coverage. As Indivar noted on the first panel, the expansion of individual insurance under the Affordable Care Act has enabled us to move beyond the pre-ACA days where people were locked into their jobs and unable to start and grow businesses simply because they needed health coverage. Indeed, more than half of all participants in the ACA exchanges are small business owners, small business employees, or self-employed entrepreneurs. The ACA has also enabled most states to expand Medicaid eligibility to a broader swath of people, including millions in the small business community. But there's much more work to be done to strengthen equitable access to quality, affordable health care. I'm just going to touch on a few things we need to do. First, we need to strengthen the ACA marketplaces even more. The extension of premium assistance offered by the American Rescue Plan was a great first step. We need to continue this assistance via the provisions in the proposed Build Back Better plan. In addition, we've got to expand Medicaid in the 12 states that have chosen not to do so. This would enable more than 600,000 small business owners, employees, and independent entrepreneurs to access coverage. You don't have it right now. Until this happens, we need a way for individuals in those 12 states to purchase coverage through the federal ACA marketplaces or alternatively through a federal Medicaid lookalike program. All of this said, as Matt noted in the first panel, we're not going to get our arms around the impediments to quality, affordable healthcare if we don't address the underlying issue of healthcare costs. The first thing we must do is make prescription drugs more affordable for everybody. There are a lot of policy solutions to this, but the first that comes to mind is lowering the cost of prescription drugs must start with allowing Medicare to negotiate prices directly with pharmaceutical companies. In the absence of federal policy, states have taken action and enacted solutions like the Colorado option, something we've been in the middle of. This new law substantially limits premium increases by insurance companies. We can and should replicate this in other states while pushing for a public option on the federal level. And finally, we must strengthen competition in the healthcare marketplaces by prohibiting anti-competitive practices by healthcare providers and hospitals, including harmful hospital consolidation. The United States is only one of 6 countries, let's talk about paid family leave here. The United States is only one of 6 countries that does not offer a national paid leave program. We are joined by Papua New Guinea and a few other Pacific Island nations in this regard. Instead, what we have is a patchwork of policies in a few states, many of which we've advocated for and helped implement. Why is paid family medical leave so important? Because we can't build and support a robust small business ecosystem or compete with larger businesses to hire and retain employees without a universal infrastructure that enables women and other caregivers to take care of their families' needs. Our polling finds that 73% of small business owners and operators feel it's important to establish a national paid medical leave program. The paid leave component in the current Build Back Better bill is now down to just 4 weeks. And even if we pass a bill, which is questionable at this point, paid leave is unlikely to be included. If we can't pass government supported paid leave, we need to at least pass measures like the Family Act, which would create a national paid leave insurance program, as we've done in certain states. Childcare, as others have mentioned, is the next component to a strong safety net to support entrepreneurship. Access to affordable quality affordable childcare is another aspect of the social safety net that impacts the small business ecosystem in a multitude of ways. First, the lack of access to affordable childcare has become increasingly difficult and is a significant burden to entrepreneurs and their employees, particularly women. What's more, most childcare providers are in fact themselves small business owners, largely comprised of women, people of color, and immigrants who are often underpaid and overworked. Our polling finds that the childcare provisions in the Build Back Better plan have strong support among small businesses. In addition to policies that promote a 21st century childcare infrastructure, we need to empower childcare businesses to be successful. In Colorado, we work directly with in-home childcare providers to help them better understand the legal and regulatory issues that impact their businesses, and we coach them how to get involved in advocacy. We also support policies that barriers that childcare providers face in starting and or growing a small business. For example, in 2021, we worked to repeal a Colorado state law that prohibited undocumented immigrants from obtaining a business license. Finally, ensuring that small businesses, their employees, and independent entrepreneurs can easily save for retirement is essential to wealth building. Many small businesses want to offer a retirement plan to their employees to attract and retain a quality workforce, but there are significant challenges to doing so. From our polling, 34% say retirement plans are too expensive, and 23% say their business lacks the resources to administer a plan. 43% of employers do offer some retirement benefits, but less than 19% offer a retirement plan to all of their employees. We must remove barriers to small business participation in retirement programs. These include cost, administrative complexity, and fiduciary liability. Research shows that a so-called auto IRA option, i.e. enrolling employees in an opt-out with an opt-out provision, ensures the greatest uptake, even when enrollment is funded only by the employees themselves. But this option must include an easy on-ramp to a retirement plan. And these programs must include the self-employed to participate. California, Oregon, and Illinois have well-functioning state auto IRA programs, and many other states are beginning to implement plans or are considering doing so. Let me end with saying that passing laws for these four benefits is essential, but it's not enough. They must be followed by robust outreach programs targeted to hard-to-reach entrepreneurs and their employees, particularly in under-resourced communities, to let them know about the programs and how they work. We look forward to getting these programs enacted and vigorously implementing them. Thanks. I'm happy to chat more during the discussion.
Thanks so much, John. Appreciate your thoughts on that. I'll turn things over now to Rakeen Mabud.
This has been a fantastic conversation, and really appreciate both the invitation and also looking forward to the discussion going forward. So my name is Rakeen Mabud. I am the Chief Economist and Managing Director of Policy and Research at the Groundwork Collaborative. Groundwork is, trying to advance a coherent, progressive economic worldview that really centers people, centers families, consumers, workers, and small businesses over the interests of, mega corporations, the wealthy, and the already powerful. And I think there's really been an incredibly rich discussion already today, highlighting some of the many programs and policies and approaches that entrepreneurs need in order to feel supported in our labor market. So I wanted to zoom out a little bit because individuals only have so much agency when the system around them is not supportive. And we are really in the middle of a once-in-a-generation policy moment. So making sure that we are able to set our economy up for success from its foundations is really crucial. And I think this is an interesting time to be having this conversation. COVID is not yet in the rearview mirror, but yet we are 2 years into this crisis. And it puts us in the unusual position of being able to learn from the current moment and also take lessons from past crises and kind of assess our trajectory in the moment itself. Because the policies that we implement now will affect our economic trajectory for years to come. For the past 2 years, we've seen how policies that center people, particularly people who have been historically marginalized, have strengthened our economic foundation, which has created a more resilient economy for all of us. But it's clear that there's a lot more to be done. And frankly, we can't afford to get complacent. COVID is an ongoing crisis, but the crisis, this moment, has exemplified the many, many ways our labor market has been broken for too long, for too many. And given the long-running nature of these debates, I think it's helpful to take a bit of a step back and evaluate some of the lessons we learned, not just from our COVID response thus far, but also from the Great Recession, and start to look ahead to the next steps in the fight for a more inclusive and equitable economy. I think the sort of too long shouldn't read version of what I'm about to say is, piecemeal approaches will only get us so far, and then we really need to reorient the way we think about our approach to economic policy to ensure that entrepreneurs and others are really supported in our labor markets. So let's turn first to the Great Recession. It was abundantly clear that Congress's response to the economic devastation of the Great Recession was too small and stopped too quickly. So as a result, we left behind some of the most vulnerable people, exacerbating racial and gender disparities in the labor market and beyond, and stymieing our economic recovery. And we saw an unequal crisis turn into an unequal recovery. Over the course of the Great Recession, the Black unemployment rate peaked at 17.3%, while the white unemployment rate never even reached double digits. Given the fact that even 10 years after the Great Recession in 2018, Black and Asian households had yet to recover lost income, and white households began to see an increase in wealth between 2010 and 2013, Black households actually saw a massive decline. The disparity between Black and white workers remains to this day. As of December, which is the latest data we have of the labor market, Black workers currently have more than double the unemployment rate of white workers. The response to the Great Recession also prioritized bailing out Wall Street and corporate America at the expense of workers, small businesses, and families. We are all cognizant that policymaking requires trade-offs, and centering the health of the financial sector over the health of families and small businesses around the country left millions with negative equity, depleted savings, and even deeper debt. And ultimately, all of those cracks in the system, from the foreclosures and evictions to unemployment and income loss, left people around the country unprepared to weather the next crisis and unprepared to set themselves up for success. So let's turn now to the COVID-19 crisis. The American Rescue Plan that President Biden proposed shortly after he took office was a clear rebuke of the tepid response to the Great Recession. And it has paid off. The ARP reflects significant progress we've made in championing small businesses, workers, and families in our policy responses. The ARP, along with stimulus payments, extending UI benefits, the moratorium on student loans and evictions, and child tax credits, help ensure a speedier economic recovery, something we're seeing even today in the latest data we're getting about the GDP numbers, and much more quickly than previous economic fallouts. We are currently in one of the fastest periods of labor market growth in history, and that is due to the American Rescue Plan. Without these important investments, experts have estimated that we would not be seeing a 3.9% unemployment rate until 2026, and yet here we are about 4 years early. This is in sharp contrast to the recovery from the Great Recession, when the US economy didn't recover fully until mid-2014. We've already, other panelists have touched on the importance of caregiving and paid leave and robust care infrastructure. And I think another important piece of that is child tax credit, which has been a critical source of income for families and folks who need support for their children. The latest research from Columbia University shows that the child tax credit reached more than 60 million children in December 2021, and the expanded child tax credit on its own reduced monthly child poverty by close to 30%. This was especially true for Black and Latinx children, who saw poverty rates decreasing by 25% and 30% respectively. And by the sixth, and this is only the sixth payment, it's not even the cumulative effect of the payments all over last year. Researchers are expecting an increase in child poverty this year as the program comes to a close. Policies like the child tax credit bolster our economy. They create higher, more stable, more consistent demand for consumer services, and by laying the foundations for greater worker productivity and well-being. Greater economic security and autonomy means that people can start their own businesses, they can access jobs that are better suited to their skills and their needs, and more money for childcare also means more labor force participation for parents, especially for mothers. The expanded child tax credits demonstrate that when low and middle income people share in the benefits of their work, our labor market, along with our whole economy, is better off. Significant expansions to the unemployment insurance system were also an important labor market stabilizers throughout this crisis. I expect that Till's gonna dig into this in his comments. These benefits and expansions and extensions were an essential lifeline to millions of workers during COVID, particularly Black and brown workers. Policies like UI keep people attached to the labor force, smooth over labor market shocks that we know can affect workers for the rest of their lives. It helps people bargain up for safer, higher paying jobs rather than settling for whatever is available just to make ends meet. And despite what some economists predicted, these benefits were not holding people back from returning to the labor market. The states that cut the extended UI benefits early did not see hordes of people rushing back into the labor market, which really speaks to the broader structural barriers keeping people out of the labor force, from care responsibilities and other health concerns that have only magnified in a pandemic in response to unsafe jobs. So to close, I wanted to highlight 3 key lessons I think we've learned over the last 13 to 15 years of economic crisis and recovery. First, centering people, workers, small businesses, and families in our policy response results in a more resilient economy and a faster recovery. This is particularly true for policies that hone in on the issues disproportionately affecting workers of color, immigrant workers, and caregivers. And this is abundantly clear in the success of the American Rescue Plan and other emergency relief programs that have been put in place since the start of the pandemic. A lot of those programs are tapering off right now, and we really need to double down on these long overdue investments in the people who really keep our economy going. Second, we have seen some important advances and increases in worker power over the course of this crisis, and these advances are not guaranteed to last without policies that institutionalize that power. That's why it's really essential that Congress also pass in a C3 way big legislation that's currently on the table, because these legislative agendas really are an important down payment towards a stronger and a more resilient labor market. Low-wage workers are currently seeing their wages keep pace with rising costs. And there's a lot of evidence that workers are starting to leverage this moment to trade up into better paying jobs and better quality jobs. But a half a century of conservative attacks on unionization and worker well-being has gotten us to this point. And the gains that are being fought for workers, but also small business owners in the market will only last if these are institutionalized through important investments in our care infrastructure, paid leave, a permanent expansion of the child tax credit, and frankly, taking on the concentrated corporate power that is crushing small businesses right now. And then finally, only massive, smart public investment will allow us to recover from the current crisis and invest in the next generation. And the federal government is up to the task. Public investment in the people who make up our economy is always good economics, and it's always great policy. Rebalancing power in our labor markets for the long haul will require large-scale sustained public investments, attention to antitrust and addressing corporate concentration, all of which will come together to generate millions of high-quality jobs, meet working people's needs, establish real checks on the powerful and wealthy few, and really enable more people to have agency over their own lives in the labor market. And a healthy and more resilient labor market has the effect of strengthening our economy and making us less vulnerable to economic crises as a whole. People are more empowered to join the labor market, to start a business, to make decisions around caregiving when they live in an economy that's built to center their needs, their values, and what they create. We have an opportunity to do that right now, to really reorient the economy from the interests of the rich and the powerful to one that all of us have, and perhaps one of the last chances, sadly, that we'll have in a very long time. And it's incredibly critical that we don't waste this opportunity. So I'll pause there and really looking forward to the Q&A.
Thanks so much, Rakeen. Appreciate that. Next, we have our third and final speaker for this panel, Till von Wachter, who is a professor of economics, director of the California Policy Lab, and associate dean for research of the Social Science Division at the University of California, Los Angeles. Till, I'll turn it over to you.
Thank you very much, Jennifer. It's a great pleasure to be here and to follow the very interesting interventions of John and Rakeen. I'll share some slides. I'm a professor, I guess that comes with the territory. And I'll be switching gears just slightly in the sense that I'll share some background on a research project that's ongoing. And I'm really happy to be here because I'm a specialist in unemployment insurance and labor market outcomes. And I have joined forces with Alexander Bell, who's doing a postdoc at the University of California and who is an expert in entrepreneurship. And I look forward to any comments and suggestions from all of you. I'm gonna change gears a little bit, and I'm gonna talk about income insurance. And just as a very high level moderator, in a world where we do not have a well-functioning general social insurance system that covers health insurance, paid leave, or childcare or pensions, right? Having a functioning income insurance system is crucial, right? Since many individuals will have to cover these other insurances out of their own pocket. And as Rakeen laid out, the pandemic really saw a massive temporary extension in unemployment insurance and other forms of insurance that also covered the entrepreneurs. And the important thing here is that during the pandemic, it was very clearly recognized that typically entrepreneurs are not well served by the unemployment insurance system or the income insurance system more generally, hence this range of temporary programs. Now, what is very well recognized that at least in principle, income insurance plays an important role in the decision to become an entrepreneur or to start a business. And I'm just going to give a very brief sort of motivation, and then I'm going to dive in and sort of talk specifically about what we will be doing in a research project that covers multiple stages and looks at different aspects of income insurance for different entrepreneurs. And I'll be more specific in just a second. But for many of you, that will not come as a surprise, but entrepreneurs are likely to value income insurance as much as employees, in the sense that income risk is and sudden declines in income can be just very detrimental to individual health, mental health, and family outcomes. At the same time, they're affected by classic trade-offs in the sense that more unemployment assistance or more income insurance may just lower effort in employment. But for entrepreneurs, right, income insurance plays a particularly salient role because they are much more actively choosing the level of risk that they're engaging in, right? Now, for all employees, really, unemployment insurance supports the ability to take riskier jobs, right? But for entrepreneurs in particular, right, they're choosing on a daily basis almost how risky a project to enter and whether they're willing to go for something that has potentially very high return, but also very high risk, or whether they need to play it safe, right? And that goes both on a day-to-day level as well as sort of over an entire career. Do I want to become an entrepreneur or not? Well, that might depend on the level of income insurance. So this goes, as I said, both for the individual entrepreneur and as you'll see also for individuals starting up firms, right? We know that young firms are an incredible jobs motor, right? And they're the ones that grow from small to larger firms, produce jobs. Well, they're also benefit from unemployment insurance, but there are also some costs from insurance, and we'll talk about that. Right? So what I'm going to do here, right, I'm going to talk about a research project that mainly focuses on the role of unemployment insurance, and you can think of that as so broadly income insurance, right, for different types of entrepreneurs. And the difficulty is that typically the information we have on different types of entrepreneurs lives in a different data universe as information. We really need to learn more how the unemployment insurance expansions in the pandemic and how unemployment insurance more generally influence entrepreneurial activity, since income insurance is really sort of a crucial form of insurance. But the problem is that the data we typically use to study unemployment insurance and income insurance really lives in a different universe than the data we have on entrepreneurs, right? And I'll be very brief, but we typically collect as workers work, right, data on their wages. We collect data on whether they use unemployment insurance, whether they use, for example, pandemic unemployment assistance, one of the programs that I'll talk about from the pandemic, and we collect information on their employers. Right? Now, this data is typically for individuals that are employees, not for individuals that are self-employed. And the difficulty with entrepreneurs is in part that there are so many different types of entrepreneurs, right? There's the self-employed, there are inventors, and then there are startups or young firms. And these are the three types of entrepreneurs. There's, of course, others that we'll be focusing on in our research. And the good news here is that through the pandemic, suddenly a very large group of individuals that were typically not using unemployment insurance were connected to the system, and these are the self-employed. We also were able to obtain a very large data sets on inventors and on their patenting activity. And then I'll be talking about information for young firms. And for each of these three groups of entrepreneurs, the unemployment insurance system may play a different role. That would be extremely important in understanding, right, what role unemployment insurance could play to better inform policy choices down the line. So let me begin, with briefly talking about the projects we're working on, and I'd be really curious about any feedback, because the goal here at UCLA at the California Policy Lab is not only to do academic research, but also then to see through the impacts and implication of this research for the programs on the ground. And that's why we're actually working in partnership with California's Unemployment Insurance Office. That's why we have access to this data, and we will be giving them feedback, and we will be, be in touch with the U.S. Department of Labor on these findings, because our mission is to help actually improve these programs and the outcomes of the individuals that use them through academic research. So let's talk for a moment about pandemic unemployment assistance. Pandemic unemployment assistance was perhaps one of the most visible, new but temporary programs that was created during the pandemic. In fact, it wasn't entirely created from scratch. There used to be another program that's called disaster unemployment assistance that is also sometimes available to the self-employed. And this program, PUA, was a temporary program that was available to individuals that were working and were not able to work due to the pandemic, but were not eligible for regular unemployment insurance. And those were individuals that were not employees. So the self-employed were one of the main target groups. It was also available to workers perhaps that had very low earnings or were just starting to work and did not have high enough labor market attachment to be covered by regular unemployment insurance. Now, you'd think, given this is such an important program, we'd know a lot about who was benefiting from PUA, right? And the answer is no, we don't. The data sits in the various state offices and is typically not accessible. And we were able to actually get the individual level data on who used PUA and have been working on figuring out, right, which individuals benefited from PUA. And so here are some of the questions we've been asking ourselves, right? And there are some very basic questions that are important to understanding how PUA helped the self-employed and maybe led more self-employed to file their own businesses, right? Or prevented them going and just getting a job, right? But we just don't know. But here we can see who actually received PUA, which demographic groups, for example, which places, and then we can see which of them entered and exited the covered labor force, right? Which is important, right? Not all self-employed or entrepreneurs are either only self-employed or work for an employer, right? They may be entering and exiting. And here now we can understand, right, what is the connection between self-employment and the covered labor force. And then what's also helpful is that we can sort of start to understand whether this massive increase in insurance, right, led to a change in entrepreneurship, in the sense that we can see whether individuals who participate in PUA are more likely to then become employees, maybe because they value the insurance, right? Or whether PUA may have enabled them to return and then start a business, for example. And one of the things we'll do, the very detailed data comes from California, but there are some state level data sources that we can use to exploit the fact that different states had a very different take on PUA. And there are important differences across states so that we can compare some states where PUA was very readily accessible and some states where PUA wasn't accessible. And that's something we've started working with. And so where we are right now, it's quite interesting. At the beginning of the pandemic, PUA was very clearly capturing a group that looked like the self-employed in California. They were more likely to be somewhat older, somewhat likely to be male and white, right? And then the question is that a success for the program, right? Or, were there important groups that did not get access? And in the course of the crisis, right, more women, more younger workers, and also a more diverse group of workers entered PUA. And so thinking through who got access to PUA and whether PUA was able to reach some of the most vulnerable that often do not have access to regular UI is an important part of the question here. With an eye on the time, I'm going to move on and talk about our second line of research, because PUA is, of course, a very important program, and a lot of individuals are trying to understand better what the program did. But there's another group of entrepreneurs that has been extensively studied because we have such good data on what they do, and these are inventors. Inventors are individuals who file patents, and in many cases they are actually employees, and hence they can benefit from unemployment insurance, and we can see them in our data, which is really helpful. And what we were able to do is combine data on inventors and patenting, or that's what we're working on, to data on earnings and unemployment insurance receipt. And the question is, does more generous unemployment insurance lead to more or less patenting activity? Does it lead to inventors to give up in patenting, or do they then patent more intensely because they have more insurance? These are some of the questions we'll be thinking about. And it really gets at the heart of this question of whether more generous income insurance supports the take up of risky activities or not. And finally, we'll be thinking about the role of unemployment insurance in young firms. Now, this is actually much closer to sort of the bread and butter, what many economists think about when they think about the unemployment insurance system, because firms play such an important role there. But interestingly enough, we haven't really focused as much on young firms and startups and how they use the unemployment insurance system. That's very interesting because young firms have sort of a window in which their payroll tax does not reflect their UI use. And after a few years, their payroll taxes start increasing if they use more unemployment insurance up to a cap. It's called experience rating. And of course, firms don't appreciate taxes. And in this case, it's very interesting because paying these payroll taxes provides a service, namely insurance for the employees, and most employees value that insurance. And so it's not even that clear whether the firm is really paying the tax or the firm is passing that tax on to workers who might accept lower wages because of that insurance. But either way, there is a benefit trade-off, right? Because firms may value having their workers insured, so the workers are willing to accept the higher risk to work at younger firms. And otherwise, in the absence of an insurance, maybe firms had to pay, these young firms had to pay higher wages. On the other hand, using UI leads to an increase in labor costs. And economists have worried quite a bit how firms respond to unemployment insurance taxes, but they haven't really thought about young firms. And that's very important because as a firm enters and grows, right, we're particularly concerned about the role of taxes, we're also particularly concerned about whether they can find workers, because young firms' jobs are particularly risky. And we're also worried what leads a firm to understand and utilize the unemployment insurance system. Because the unemployment insurance system, even among employees, tends to be underutilized in the sense that many unemployed workers do not receive UI. And that may be partly because their employers discourage use of UI, or they're not aware of unemployment insurance. And so studying young firm really addresses a set of very interesting questions, both about whether it allows young firms to grow faster, whether they value the insurance or they're affected by the cost, right? But also, how does the unemployment insurance system really work, and how do firms interact with the system? Yeah, I'm going to wrap up, right? We've talked about a range of questions that we have about how valuable income insurance is to entrepreneurs, and whether there are maybe some unintended consequences of providing additional insurance. And I think we're all in agreement that more insurance can be very helpful, but of course we'd like to have some hard numbers, and that's what we're working on by comparing a series of data sets that usually don't live together. And we have a unique opportunity here to exploit some of the changes that happened during the pandemic and some of the institutional features of the unemployment insurance system to really learn more about the role of social insurance for entrepreneurs. And I'm going to stop here.
We appreciate it. Just for all our attendees, feel free to pop any questions you might have for our panelists into the Q&A box. I'll invite all our panelists now to come back and put themselves on video and unmute themselves so we can have some Q&A. Again, thank you to all our panelists for your presentations. I think we covered a wide area of topics throughout panel 1 and panel 2, so I'm excited to see where this discussion might lead. It looks like we do have one question from an audience member saying that her dilemma as a sole proprietor is having to pay 1/3 of her income in taxes, which is indexed below the poverty rate, while some billionaires and corporations don't pay any taxes. So she asked, how can this be overcome?
If we've learned anything from the comments today, it's that we are living in a really imbalanced economy, an economy that deeply prioritizes the wealthy, the powerful, these big corporations that then exert their power and their wealth to shape a system that doesn't work for us, but it works for them. And so, I think we've heard a range of proposals that will start to correct for that imbalance, right? From care supports to a more sustainable and robust unemployment insurance system. I think there are a couple of proposals we haven't talked about, including tax reform and antitrust, which I mentioned briefly. But this is kind of what I was trying to get at the, in my comments, which is that we really do have to look at this as a system and as a holistic problem. We're not going to fix the power imbalances in our economy with one policy proposal, sadly, right? Like there's no magic bullet. And so I think everyone here has really brought to light the range of issues that we need to be taking into consideration to correct that, and also start to think about these things as parts of a whole, as opposed to sort of siloed individual policy interventions.
Yeah, I'll just add that our tax system is, I completely agree with Rakeen. Our tax system is completely upside down. It doesn't in any way support starting businesses, growing businesses, hiring people to work in small businesses. I mean, I could go on forever. It's so skewed. Even they made this big push to reduce pass-through taxes on pass-through income in the Trump tax bill that was passed in 2017. But when you do the math, basically the vast majority of the benefits well over half of the benefits went to the top 3% of pass-through income earners, which really were not the sorts of small businesses that we think about. They were vehicles for people to do certain things financially. They weren't starting up the sort of businesses that we think of as small businesses. So I could go on. I mean, we really need to have a system that starts, providing tax incentives from the bottom up, and not sort of cloaking them in tax breaks for people at the upper end of the spectrum.
Yeah, thanks, John. We also have another audience question, I believe, directed towards Till, that says, how are individuals permitted to openly use UI benefits to open a business when they are required to actively seek full-time employment? And maybe adding to that, is that something you've seen in California, or is that something that kind of comes across the board when it comes to UI insurance?
Thank you for raising that question. It's an important question, and there's an important distinction to be made. Pandemic Unemployment Assistance was a program that has now ended, that was explicitly geared towards individuals that were self-employed and hence were not necessarily seeking full-time jobs in the covered sector, meaning as employees. But if somebody has regular unemployment insurance in most states supports looking for a full-time job. And then there's a whole range of exceptions that states can pass, right? Sometimes they support looking for part-time jobs, and in some cases there are specific programs that individuals can use to transit to self-employment, but that really depends on the state in which you're in, and in particular the self-employment programs may not always be active, right? So it is actually a difficult situation. That's one of the headache with unemployment insurance in the United States. It's a state-based program. The states get to make up their own rules, right? Some states are really eager to provide unemployment insurance to their workers, and some states aren't. Some states have a range of programs to sort of make the tent larger, right? And some states don't. And the unfortunate news is that typically, right, getting unemployment insurance as an employee and not looking for full-time work, but instead trying to try to open a business may not qualify, but it really depends on the state. But it is a very good question, sort of that raises the need to, as we think about unemployment insurance reform, right, to better integrate the needs of the self-employed, and that can consist in having a pandemic unemployment assistance arm, so to speak, but there are ways in which the regular UI system can be tweaked to make it more accessible for the self-employed.
Yeah, thank you for that. And speaking of kind of a state-by-state approach, John, I know you mentioned that the kind of that need to expand Medicaid in the 12 states that chose not to. Can you speak a little bit more about how that expansion might help entrepreneurs?
Well, there's right now, if you look at traditional Medicaid, excuse me, there's a big gap between where most states were prior to the ACA and the 133% of federal poverty level required to enter the exchanges. So, the 38 states that expanded Medicaid have closed that gap, and it's benefited millions of people in the small business ecosystem. We still have that gap in the 12 states that haven't. Obviously, we're pushing hard to get those states to move. But if that doesn't happen, the federal government can do one of two things. They can allow residents of those states to buy into the federal exchange, which is the easiest way to go because the structure is already set up, or there is a proposal, there's a bill pending, I don't think it's going to go anywhere, that would set up kind of a parallel system, which is more complicated because you're now setting up a new system, not using an existing system. Politically, the states have moved grudgingly, even with Republican leadership, to pass Medicaid expansion, but there are 12 states that are stubbornly with their heels in, and if we can't move them, the federal government, we think, needs to step in and do something.
Thank you, John. And maybe kind of turning to Rakeen, what you've mentioned. So you talked a little bit about about the increase in worker power that we've seen recently and the need to have these powers kind of reflected in policy change. But we also heard from the last panel that there are a number of challenges that entrepreneurs face in currently providing benefits that workers might see as competitive in taking a job with these kind of firms. So what kind of policies, kind of from an entrepreneur perspective, do you think need to be cemented in policy that can also help institutionalize this worker power?
Yeah, I think, it's often, the story is often told that there's like small businesses and then there are workers, right? But I think that the way our economy is set up, there's actually like really big businesses, there are entrepreneurs and workers. I mean, everyone is being harmed in this moment by the massively imbalanced power dynamics we're seeing. So, you know, many of the policies and practices that we've talked about in this panel would support small business owners and allow them to provide a good job for their employees. I mean, these are not, I don't think these are mutually exclusive ideas. And you know, the federal government has a lot of power, right? If the federal government invests in a robust care infrastructure and really makes care affordable and accessible, if the federal government invests in a more robust unemployment insurance system and gives people the flexibility to leave a job if it's not that good, if the federal government takes on, you know, really shoring up healthcare and making that more accessible and affordable and, dare I say, free for many people. I mean, there are lots of ways to reform our system such that it doesn't put the onus on business owners. And I think we have a lot more agency than I think we are often led to believe. And by we, I mean policymakers, I mean Congress, I mean the administration. And there are some really important pieces of legislation on the table that will start to address this, but it's a first step, right? And even that first step is now being curtailed, sadly. And so I do think it's important to reorient this conversation from a us versus them mentality, because really at the end of the day, the people who are extracting are not small business owners. The people who are extracting are these mega corporations that are putting these small business owners out of business to begin with, right? And really decimating communities and a vibrant, you know, local economy. And so, you know, I would challenge a little bit the premise of that question and also really point to the power of policy to create a system that works for everyone.
Thanks, Rakeen. And then I think I have one final question before I'll kind of open it up to the three of you for final thoughts and wrap up. But Till, I know you mentioned that young firms kind of may not participate in unemployment insurance. And like, do you have any thoughts on how entrepreneurs might be able to kind of talk to policymakers or how they can be reached in seeing this as a social safety net benefit?
You know, probably I don't have so great insights on, you know, what the best way to lobby is, but certainly there is a better understanding of what unemployment insurance can do and implies, both for workers and young firms. I think is very important, right? And that really starts with just some very basic understanding of what the system is, and you know, and some basic numbers of the value of the system. I think the problem is that unemployment transitions can be extremely costly for workers, especially if they happen in recessions, and they can really last for many decades, right? That's something that is business may or may not really factor in, and it can be quite costly as a business to provide a contract that, you know, ensures this worker against such a high level of risk. And young businesses, by the nature of what they do, are risky, and we want to support young businesses because we know that that's an important job motor in the United States that's been shown quite extensively. And so unemployment insurance sort of steps in and allows workers to take up these more risky activities, and hence makes it easier for young firms to find jobs. And so understanding that that's the role of UI, and it's not just an added piece of the payroll tax, is very important, right? And there's an important question here for firms, at least to be part of the conversation, as to how to structure a fair unemployment insurance system, in the sense that typically the way the system works in the US is that the more you use UI, right, the more costs you have. You know, you're imposing a cost to the system if you constantly send workers into unemployment. And the idea here is, of course, to tax those firms or businesses that have, you know, a lot of temporary employment and are very seasonal. And that might be some, you know, self-employed or smaller businesses. But really, right, the idea was not to tax young firms that are growing and may have high risk, right? So having a conversations about how to best structure, you know, the payment for unemployment insurance so that it supports growth of young businesses is a very good idea. And having young businesses sort of be an active participant in that conversation is a very good idea as well.
Yeah, thank you. It looks like we have a few more minutes, so I just wanted to open it up to the three of you for any final thoughts you might have.
I guess I can start off here. I mean, what we have an economy that everyone thinks about it as you have employers and employees. And our system is set up on that basis. All the stuff we talked about, UI for sure, healthcare, paid leave, retirement, et cetera. And the reality is we have an economy that's dramatically changing, and even more so coming out of the pandemic. I'm glad that on the last panel and this panel, we've talked about the self-employed. And the last numbers we saw, it was up to like 24 million. It's going to be a lot higher than that when we start to look at the data coming off of the pandemic. And we need to have a system, a set of benefits, a safety net, whatever you want to call it, that is designed for this new economy. And not to pit employers and employees against each other, but to say we've got this whole ecosystem. Most people who are small businesses that employ people, they care about the employees and they want to do well by them. They're not able to offer the kind of benefits that the big corporations can. There is a tax system that sits upside down, as I said. So we need to rethink all of this, and we need to rethink it, looking at what entrepreneurship really is, who's part of it, who's driving it, who are the stakeholders in it, and design systems that match that.
Yeah, I'll echo a lot of what John just said. And, I agree with all of that. And I'll say the whole economy is stronger for it when we create a better ecosystem, right? This is not just about improving a particular segment of workers or a particular segment of our economy, although it will do that. It's that when we shore up the system such that people have agency, can make decisions about their lives, whether that's starting a new business, whether that's to have a family or to take care of an elder or loved one, all of that makes our whole economy more resilient. All of that makes our whole economy stronger and better off. And so, I would echo a lot of what John just said, and remember that, we are in a pivot point. This is a moment where we actually have a chance to put in place a lot of these reforms. It's a moment where we are seeing the cracks in our economy clearly in a way that we haven't seen in a really long time, although they've been there for a really long time. And so I think all of us, as we're doing this work, really keeping our eye on that vision of what does an economy that works for all of us look like, and moving ourselves closer to that.
I'm gonna jump in, pigging back of that partly. So the one concern, especially for small businesses and entrepreneurs, is that absence a lack of social insurance across the board, having some form of income support or wealth to support starting risky activities becomes very important. Now, it's well known that both the income distribution and the wealth distribution in this country are extremely skewed. And there are many groups of workers that don't have access to that type of, say, family-based or network-based insurance that would come with high income or high wealth, right? And so having a more functioning social insurance system and more functioning income insurance would really benefit those groups that tend to be already marginalized in the labor market, right? And really increase equity also in the space of entrepreneurship and self-employment. And one difficulty in driving that point home very forcefully, right, is that typically we don't have a lot of data on the self-employed. We have data on small businesses, but often we don't know who owns these small businesses. So we don't know what equity in that space is, right? Data on the self-employed is scattershot surveys and so on. So to really make some of these points harder, and as we're lobbying for improvements, I'm going to make a sort of a professorial point. It is very important to think about better data on the self-employed and on entrepreneurs, so that we can really show, how the skewed income and wealth distributions in these countries and existing inequity is sort of perpetuating itself and hurting especially the more marginalized group. So how to measure that well and make that crystal clear is an important part of the question, right? And as we lobby, we also need to lobby for better information.
Yeah, thank you for those points. John, Rakeen, Till, thank you so much for joining us today on this panel. We really appreciate you taking the time to do so. With that, I'll turn things back over to Anya for some final closing remarks.
Thank you, Jenny, and thank you all the participants on our second panel. I want to thank also all the attendees for joining us today for this important conversation. We just spent 2 hours, but it still feels like we only scratched the surface of the issue of social insurance for entrepreneurs. We had a rich discussion, and I would like to thank all of our presenters today. We are grateful for your time and insights, and this forum has been recorded, and we are going to share the video in the future. And I want to also take a moment as an opportunity to announce our next forum scheduled for February 24th. The topic is the Great Resignation in Entrepreneurship. The registration link and link to our recorded forums are in the chat. And we will also be sharing more information about the upcoming forum and other events in our Insights to Entrepreneurship newsletter. And you can find the link to where to sign up in the chat as well. We hope you will join us in the future events. And thank you all again, and have a wonderful rest of your day.